Hi, my name is Jessica Anderson, and I'm a certified nurse midwife at the University of Colorado Hospital Center for Midwifery. Today we're going to talk about birthing positions. There are many positions that you can utilize during the first stage of labor. One of the positions that you can use is a sideline position. This position is wonderful for early labor as it allows you to rest during the contractions. Often women are able to get a little nap in between their contractions and you don't use a lot of energy with this position, so it can be really beneficial in those early stages of labor. Another wonderful position is the hands and knees position. This is great for the first and also second stage of labor. For first stage of labor, it's nice for women who are having a significant back pain. Getting this position can help your baby rotate, and it also allows for your support person to give you some assistance with massage or pressure on your lower back. Another position that's really beneficial for the first stage of labor is standing. Typically this is a position that women use in the first stages of labor or the early stages of labor. It's nice because it can help promote progress in labor. It also can promote comfort and decrease pain. Typically what women will do is they will stand, and then when they have a contraction come on, they will utilize a support person to almost do a type of slow dancing position. They will utilize this position during the contraction, and then will typically stand up when the contraction is over. Another wonderful position to utilize in the first stages of labor is walking. Walking can actually help promote progress in labor, and it can actually help your baby to get into a wonderful position to help the birthing and labor process. Walking is nice as women are able to walk, and then when they have a contraction come on, they can stop and do relaxation techniques to get through the contraction. Typically, walking is something that is used more in the early stages of labor. The sitting position is also a great position to utilize in the first stage of labor. There are several ways that you can use the sitting position. You can use a birth ball, a birth stool, you can sit on the side of a bed, and you can also use the bed at the hospitals to get in this type of position. This is wonderful as it allows women to rest between their contractions. Women can lay their head back in between, shut their eyes, and get a little nap. It's also a great position as you utilize gravity to help your baby drop and settle into your pelvis into an optimal position. Another wonderful position to utilize in the first and second stages of labor is the squatting position. The squatting position is wonderful as it opens your pelvis and helps facilitate your baby getting into a wonderful position for birthing. The nice thing about the squatting position is that women are able to pull themselves up into a squatting position. They then push during their contraction, and when they're finished pushing, they can sit back into a more supported position to conserve their energy. Another position that you can utilize for the first and second stages of labor is an upright position on a birth stool. Birth stools are wonderful as they help gravity and help your baby settle into a wonderful position in your pelvis. It's also a position that you can utilize for pushing as well. This position is nice for pushing as it really helps you get a powerful push because you're in an upright position, and it also allows the mom to be very involved in their birth. In the first stages of labor, the birth stool allows your support person to have access to your back if you're having a lot of back labor or pain. Your partner can give you pressure on your lower back or can also massage your lower back as well. The birth stool is something that can be utilized in the second stage of labor. Women are actually able to push and give birth in this position. If you're having a birth on the birth stool, your provider will typically be on the floor, like I am, and will support your perineum and assist your baby into the world. One thing that has been found for some women, particularly women having the first baby, you can have larger lacerations on the birth stool. So often, if you are having your first baby, your midwife or provider may suggest that you only push in this position and give birth in a different position. birth ball is something that you can utilize during your entire labor. It's something that can be used during early and also the active phases of labor. The nice thing about the ball is that there's many different positions that you can use. And it's also wonderful because it helps decrease the pain, it promotes comfort, it's wonderful if you're having back labor, and it also helps the baby get into the right position by utilizing gravity. One of the things to remember regarding safety with using the birth ball is that you want to have a support person around you so that you do not fall off the ball. You also want to make sure you get a ball that fits your height, and so that is something that you can look at the box when you're purchasing your exercise ball. When you're on the ball, you can use a rocking position from front to back, or you also can go from side to side as well. It's also really beneficial in between contractions. You can lay your head onto the pillow and you can get a little rest in between your contractions. One of the nice things to do for women when they're in labor is to put a little pressure in their lower back. This is particularly helpful if someone is having a lot of back labor. Just giving a gentle pressure during the contraction can be really helpful. The other thing you can do is between contractions is just give a little massage. And this is nice if you have some lotion or aromatherapy oil. This can be really helpful for women. There are different sizes of balls that you can use while you're laboring. We've already seen the larger ball that you can sit on. There's also another ball that's smaller that you can actually utilize on your hands and knees. This is a great position if you're tired. It allows you to rest between contractions. It allows your support person to really get in and do some support measures on your back. You can rock back and forth from front to back during the contractions. You can also go from side to side. And this also allows your support person to really push on your back if you're having back pain, or also provide massage as well.